Thanks for inviting us in tonight. Pfizer could now be paving the way for the next round of COVID vaccinations, this time for Americans age 5 through 11. Now, we know this is probably going to impact lots of Indiana families, so let's get right to it. Our big story tonight looks into how this approval process for the COVID vaccine works and how some Indiana parents feel about it. But first tonight, we're hearing from pediatricians who say they're hopeful about this next phase of the vaccine rollout.
The newly released data from Pfizer comes as schools are in full swing and pediatric cases are soaring.
As a pediatrician and a parent myself, we've been eagerly awaiting news about a vaccine for our younger kiddos.
Dr. Suzanne Grannon is the pediatric medical director for Community Health Network. She says a vaccine for younger age groups could give doctors another tool to fight this virus and its contagious variants. Right now, data shows pediatric COVID cases have jumped 240% since July.
With the start of school, it was pretty chaotic, and the best advice I could offer to parents was, get your vaccine for yourselves, because that surrounds your kids with vaccinated adults, and have them wear masks indoors.
But now kids could have another form of protection. So let's take a look at this trial. To start, the FDA asked for 6 months of follow-up safety data instead of the 2 months it asked for with adults. It also asked Pfizer to double the number of kids in its trials between the ages of 5 and 11. And keep in mind, this isn't the same dose that adults get. The trial uses 10 micrograms instead of 30.
And what they were trying to determine was the optimal amount to have the same immune response with a minimal amount of side effects.
The hope is to have this vaccine ready for kids by Halloween. Dr. Grannon says some parents are eager while others plan to wait. Either way, she says families should talk to their doctor if they have concerns or questions.
In order for a vaccine to get a green light, there are steps that a company has to go through. They put their vaccines through multiple phases of trials to gather data to share with federal regulators. After getting emergency use authorization, those studies then expand to include real-world data. An FDA committee reviews information for the agency to approve, and another independent group reviews the safety and efficacy information so the CDC can issue its guidance. Once it goes through both the FDA and CDC, then it can be given to the public.
Now, a recent poll from the Kaiser Family Foundation revealed about a quarter of parents with kids between the age of 5 and 11 would vaccinate them immediately after emergency approval. But about 4 in 10 wanted to wait and see how it worked. So tonight, our Emily Longnecker reached out to Hoosier families to see how they feel about this new development.
There's just too much at stake.
That's why as soon as she can, Victoria Barrett will be making appointments to get her sons, Finn 6 and Ewan 5, the Pfizer vaccine. It's a moment she's been waiting for since the pandemic began.
I am ready, and they are ready. So we're ready.
I think this is the coolest.
Just last month, Barrett was getting the boys ready for back to school in Indianapolis, hoping, despite them being unvaccinated, mask requirements and their school safety protocols would keep them safe. After they get the vaccine, some of that worry will be lifted. Some of it already has for mom Diana Dingus. Her 13-year-old daughter Audrey got the vaccine right before school started this year. Dingus is also vaccinated. Next up is her 11-year-old son Brecken.
I've always believed in vaccination and medicine for my children, and to me, this is not different.
Dingus says she didn't get Audrey vaccinated right away, instead waiting to see if new information would emerge. In the end, though, Dingus said her daughter asked to get the shot.
Yeah, I did have some hesitation, but what we do know about COVID is that people have died from it.
That hesitation is gone.
There's nothing that I love more than my kids, and this, for me, is protecting them and others.
For mom Lauren Bauer, the hesitation is still there.
It just comes down to how much do we know about this specific vaccine? And we don't have long-term studies.
Bauer says she's not against vaccines, but she and her 4 kids, ages 17 through 10, won't be getting this one.
For me, I'm relatively young. My kids are young. We're healthy. We don't have underlying conditions. But if you would ask me, should my parents get vaccinated? Yes, I was telling them to get vaccinated because they're in their 70s.
For Victoria Barrett, the rewards of her young children potentially avoiding a severe case of COVID versus the risk of side effects from the vaccine are worth it.
Oh, I feel like even though it rolled out quickly, it's been in so many bodies that I do think we know it pretty well.
We took a closer look at this next age group for the vaccine, and here's what we found. More than 43,000 Hoosiers between the age of 5 and 11 caught COVID since the beginning of this pandemic. But tonight, we want to go ahead and dig into the trends that we're seeing now compared to what we were seeing last year. So last fall, nearly half of the school cases, 48%, were teenagers. Kids between the age of 5 and 9, 16%. And then the final third, this section right in here, that's children between the age of 10 and 14. So now I want to go ahead and compare that to what we're seeing this year. High schoolers who can be vaccinated represent 28%, so we're seeing a much smaller percentage of COVID cases than we were a year ago with teenager. The younger groups, though, as you see, 26% and 44% now represent a much larger portion of the cases that we're seeing throughout Indiana schools. Now remember, you can keep track of COVID cases throughout Indiana schools along with the latest timeline for youth vaccines. Just open up the WTHR app.